I spent days trying to retrace my life, trying to find at one point in time I could say, yeah, that's where I got the disease, but I wasn't able to. So it actually made accepting my diagnosis that more difficult.
When a doctor takes you to a private room, that's always a bad thing, I've learned. But he had let us know that our daughter was diagnosed with cancer of her liver.
No parent wants to hear that their child is sick, and no parent wants to see their child, endure these things.
Our beautiful, healthy daughter that had never even had a broken bone or a laceration, or she never had stitches, this little girl got sick.
The Friends organization came about really like it sounds. It was some patients who were grateful patients and some concerned business leaders in town got together and said they wanted to do something to help support the liver program here at St. Louis University. That has become is a very solid, not-for-profit charitable organization that raises money to support research in liver disease and to support educational activities in liver disease for our patients who we take care of here at St. Louis University.
So the Friends of the St. Louis University Liver Center have been very important, indeed critical partners with St. Louis University and our faculty here in making progress in liver disease.
Donations from the Friends of the St. Louis University Liver Center has allowed us to form a seed grant program where we can support ongoing research of our investigators so that they can move forward with their preliminary data and their findings to submit grant applications to secure larger grants from the federal government and from various foundations. We've been successful at acquiring over $11 million in these external grants since the inception of our seed grant program.
The Friends of the St. Louis University Liver Center have impacted my work in a very deep manner. They have provided funds for me to get started on a really exciting new project that involves looking for new drugs to help people who are infected with hepatitis B virus.
Also, donations from the Friends of the St. Louis University Liver Center has allowed us to purchase some very important state-of-the-art equipment to be used by our investigators in their laboratories.
To develop the new drugs that the clinicians like Adrian DiBiscelli work with in patients, there's 20 or oftentimes 30 years worth of work done in a lab just like this that goes upstream of that, and that's where I fit into this spectrum of research. I'm a basic researcher. I'm making the initial discoveries that will eventually, if we're lucky and we work really, really hard, will lead to new drugs that will save people from the scourge of liver disease.
Both of my daughters, Abigail and Catherine, have kidney and liver disease, and they have both required a kidney and liver transplant.
I started going into the hospital a lot. They always had to stick me somewhere, so not so good.
In December of 2008, I was diagnosed with hepatitis C, and it devastated me. While I was going through treatment, things as simple as some of my hobbies, which include remodeling homes, riding my motorcycle, playing with my children, grandchildren, I couldn't do most of that. I would struggle home every day from work, and I would make it to the bedroom, and I would collapse. And that was, for the most part, my life for 6 months.
I'm Zoe Kinstra.
Zoe is our 14-year-old daughter who is incredibly intelligent.
Well, I like to swim and I like to play volleyball, and I'm kind of a nerd. I like Lord of the Rings. Well, after I got diagnosed, I didn't go to school that much because I was on a chemo pill, and that made me kind of weak.
Less than 2 weeks after Zoe was diagnosed, we had a plan of treatment, and that was to receive a new liver, which would totally cure her of her cancer. So we were put on, Zoe was put on the transplant waiting list.
Oh, it was 8 months.
And
yeah.
we waited for 8 months till we got the call that the transplant team had a liver for our daughter. That was very exciting. It felt like Christmas. Sitting next to my daughter's bed, she had just received her transplant. She was still on a ventilator, and it was difficult to look at her like that. But I knew that she was cured. This journey was over. My daughter could have her health back. I felt so humbled through that whole process that she was going to be okay.
Some days I forget anything happened. I've ever had liver cancer, I've ever had a liver transplant, or anything was ever wrong, and those are great days.
It just feels like the world has opened up to us. We can travel now, we can have other opportunities, we can go to school all week long, like normal kids.
Without the transplant, I still wouldn't be able to eat pizza. I'm really thankful that all of the nurses and nice doctors were there because they really respect all of the patients.
We see every day the impact of liver disease on our patients and their families, and we are passionate about providing the best medical care possible to our patients.
Liver disease is such a serious problem worldwide and here at home. So many of our friends and family are suffering from these diseases, and solving them to the point where we can develop new drugs and new therapies is so difficult. There are so many blind alleys that people go to. About 99% of new drugs candidates that are found in a lab like this fail before they get to people and can be used in the clinics by the physicians. We really need to explore all of these avenues to see if we can get around the dead ends. And it's simply long, slow, tedious, meticulous, and very expensive work.
We need your help in this battle, this fight against liver disease. There are so many patients and families that are dependent on your assistance.
Those who support this are making a fantastic difference in people's lives.
Their research has saved my daughter's lives, both of them.
They can continue doing the great work they do and keep saving lives like they saved mine.